So first of all, let's have a look at the metabolism of purines and pyrimidines, which will help us better understand the pathogenicity of this condition, which is known as gout. Let's understand the metabolism of purines and pyrimidines through this flowchart. Now, the nucleic acid turnover results in the formation of glutamine as a substrate. Now, what happens is this glutamine is basically formed from the cyclic AMP and the GMP that are formed initially. Glutamine is then converted into hypoxanthine and then finally into xanthine with the help of an enzyme which is known as xanthine oxidase. Xanthine is converted into the final byproduct of this whole enzymatic reactions, which is the uric acid. Now, as for the uric acid, you'll have to remember that this is excreted from the body by the glomerular filtration. Let's have a close-up of this excretion by the glomerular filtration. As for the excretion is concerned, 90% proximal tubule reabsorption takes place and 50% active secretion. On the other hand, 50% reabsorption takes place again at the distal end. The final result is 10% excreted load of the uric acid. Now let's have a look at the nucleic acid turnover which is taking place. The RNA and the DNA are hydrolyzed by the pancreatic enzymes, that is the ribonucleases and the deoxyribonucleases, into the nucleic acids, such as adenine and guanine, which are further broken down to purines and pyrimidine bases and pentoses by the enzymes in the intestinal mucosa. Now, remember over here that DNA and RNA are formed as a de novo in our body, which means that they are formed right from the scratch. And on the other hand, they can be formed by the byproducts of these purine and pyrimidine metabolisms. So this pathway in which we have the formation of the DNA and the RNA by the metabolism of purines and pyrimidines, this pathway is basically termed as the salvage pathway. Now, this salvage pathway is basically the enzyme involved for the salvage pathway is the AGPRT enzyme, which we'll be focusing on later. And the deficiency of this particular enzyme can also result in a genetic condition which is known as the Lesch-Nyhan syndrome, which we'll be discussing separately in a separate as a separate entity in a particular lecture. Also focus on the fact that there are certain conditions which can increase the nucleic acid turnover, such as the myeloproliferative diseases, conditions such as psoriasis, cytotoxic chemotherapy, which is also known as the tumor lysis syndrome, then factors such as a rich diet and the consumption of alcohol may also increase this nucleic acid turnover. Do remember that if there are any conditions impairing the renal function, such as intrinsic conditions of renal disease, age, and dehydration, or if there is a renal impairment secondary to drugs, such as low-dose aspirin, furosemide, thiazides, alcohol, there will be increased serum uric acid levels. So to summarize and cut short, uric acid is produced and excreted as shown in this diagram. Any factor causing the overproduction or under-excretion will raise the serum uric acid levels. So here I have highlighted these 4 levels. If anything goes wrong at the level 1, where we have the AGPRT enzyme, that is the deficiency of this enzyme, or the xanthine oxidase, which acts at level 2 and 4, this is going to result in an increased serum uric acid levels. On the other hand, we have level 3, which is basically highlighting the disorders or the conditions which can ultimately increase the nucleic acid turnover, and ultimately the result would be an increased serum uric acid concentration, resulting in the condition of gout and painful joints, along with all the other symptomatology that we'd be discussing. The risk of developing acute gout increases as the serum uric acid increases. Levels more than 540 micromoles per liter increase the incidence to almost 49 per 1,000 individuals. In the next bite, let's have a look at the clinical features of gout.